Hello and welcome to this special show. I'm Mamta Chopra. In current times, the paramount problem before the whole world is how to deal with COVID-19 pandemic. How is the world coping up with this coronavirus, SARS-CoV-2? To talk about it, we have with us Dr. Soumya Swaminathan, who is the Chief Scientist at World Health Organization. Dr. Swaminathan, welcome to Doordarshan.
Thank you very much. Namaskar.
It's indeed a pleasure to have you with us. And I would like to start with the question, answer for which everybody wants to know, and that is, considering the trials for the different candidate vaccines which is going on in different parts of the world, how soon can we get a vaccine which is safe, which is effective, and also which is available for people at large?
Indeed, that's a question that everybody is interested in, so are we. And one thing has been incredible and unprecedented, I think, is the vaccine development program for COVID. Never before have we seen such a rapid pace of development, starting right in January after the genetic sequence data of the virus was made available by the Chinese scientists on January 12th. There were so many vaccine development programs that started. And as you said, today we have over 200 candidates at some stage of development. And about 30 of them are already in clinical trials, which is, the human phases of the testing. It goes through phase 1, 2, and 3 trials. The phase 3 trials are the largest that are done in tens of thousands of people, which actually prove, and we have 8 candidates in phase 3 trials. Now, normally all of this would have taken years. It's all happened in a matter of 8 months. So it's incredible. Now, we will need to wait for the data from these trials to know which of these is safe and effective. The preliminary data, which we see on the immune responses, is quite promising for most of these candidates. Middle of next year is when I think these vaccine doses will actually start getting distributed in countries and become available to people. But we have to remember, in 2021, the vaccine supply is going to be much less than the actual need or demand. And so there will have to be prioritization of some groups of people who are going to receive it first. And this is
WHO, in that regard, we can say it's a world organization, World Health Organization. So, of course, it has a big responsibility to make sure that, especially the poor countries, the weaker countries, they are not left out. So, to ensure this equitable distribution of vaccine, is there any system that WHO has developed? How is it working?
Absolutely. So, this is our priority. And you correctly pointed out that the risk is that you have vaccines developed, but then they're not accessible or available to a large majority of people. And that's not a good outcome. So we launched the ACT Accelerator in April of 2020. This is a program to accelerate the development of COVID tools. It's a collaboration between WHO and all the global agencies like Gavi and Mutated, Global Fund, World Bank, the Gates Foundation, and many, many countries who decided collectively that we need to work together on 2 things. One is to accelerate the research and development of diagnostics, drugs, and vaccines. And secondly, to ensure equitable access. Once you have the tools developed, the bigger challenge actually is to make sure that it's fairly and equitably distributed around the world. And so we have developed something called a fair allocation framework and a mechanism where we have proposed, and member states, our 194 countries which form the WHO's member states are discussing and have provided a lot of feedback. In that, the basic principle is that if you have limited supplies initially, you must divide them equally to countries around the world so that all countries are able to protect those priority populations initially. And then as volumes of vaccine go up, you can progressively increase the percentage of the population that's covered. The opposite situation is some countries, the high-income countries, get all the vaccines to begin with, and everyone else is waiting. And that's not the situation we want. We want everyone to agree that whether it's frontline workers or healthcare workers or whichever group of population you prioritize, they must be equally treated regardless of the country that you live in. So that's the fair.
This will be kind of a humongous task before WHO, because we know that many countries have already booked orders for these vaccines well in advance.
That is true. but there is also the opportunity for us to still have that global pool. So we've created the COVAX facility, which will be housed in Gavi, which is the agency that currently distributes vaccines to more than 75 countries globally. So they have the capacity to do that. The idea is to pool procurement and also to pool the risk. So if you invest in the COVAX facility, we're asking countries to put upfront investment in the COVAX facility and buy vaccines from that. Then it allows the facility, it allows us to look across and see the different vaccine candidates and buy those which are not only good in terms of safety and efficacy, but also in terms of price and other characteristics like storage conditions and things, and then distribute them to the world. There'll be some countries which will buy vaccines because they are the high income, upper middle income countries, so they are self-financing. And then there are about 90 countries where the vaccines have to be paid for by grants, by global aid agencies pooling money into this facility. So we need to raise about 12 to 15 billion dollars by next year in order to make this work.
Since the time this pandemic started, many questions are being raised about the way WHO reacted to this pandemic. How do you answer these questions?
Yes, and of course, one should always be open to criticism, open to comment, and should be willing to be transparent about how things are done. And that is why this independent pandemic preparedness review panel has been set up, and it's a very high-powered panel. It is co-chaired by two ex-heads of state, so Helen Clark and Ellen Sirleaf Johnson. They are currently developing the terms of reference for the panel and also selecting other panel members from around the world. This panel is really going to look at the response, both how WHO responded and how countries responded, and what were the gaps, what were the challenges. I'm sure that when you look back in retrospect, you always will identify things that could have been done better and that should have been better. And this is a learning. Everyone must learn from it. Of course, we must do better next time. So this is what we would like, and the Director General has been very clear from the beginning that we will be open to this kind of assessment, but countries should also be open then to assessing their own responses as well and learning from them.
I would like to ask a question about the mutations, because we know that this RNA virus, that is the coronavirus, this has a tendency for mutations. So keeping that in mind, people do feel that how is this tendency going to have an impact on development of immunity and as well as development of vaccines?
That's a very good question. And I think people get confused because there are so many news items that come about, this strain of virus and that strain of virus. So what you said is absolutely correct, that viruses, especially RNA viruses, mutate. The good thing is that this virus is mutating less than, say, the influenza virus, which, as you know, every year, the strains of influenza virus keep on changing. And for the vaccines, every year, WHO actually coordinates the development of the strains which should go into the vaccine. And that's a lot of additional work. But this SARS-CoV-2 virus is mutating much more slowly, but it does mutate. And in fact, there's a global database now of this genetic sequence data. More than 80,000 sequences have been put into that database. And so you can already see the differences and the different strains, about 8 or 10 different subtypes or clades of this virus. And the scientists are tracking it very closely for 2 or 3 things. One is to look to see whether the strain is changing its clinical behavior. Is it becoming more severe, more virulent, or less, or milder? That's being tracked. As of now, there are no very clear indications of that. Secondly, it's being tracked to see whether the vaccine or the drugs will stop working because of the mutation. And so far, the spike protein, which is the protein against which the vaccines are being made, has not really changed much. There are minor mutations, but nothing major enough to interfere with the vaccine. So,
but when there was a news from Indonesia, they said that they have found the mutated strain of this virus, which is very dangerous, perhaps more than 10 times more infectious than other strains. And they find that the number of spikes increase in this kind of mutated strains. So do you think that we need to control this kind of mutated strains, which is found to be more dangerous?
So one of the mutations that's been tracked is the D614G mutation,
Right.
which has been found to be more transmissible, at least when it is being done in the lab. Now we need more studies like the one that you mentioned from different countries to correlate the epidemiology and the genetic features of the virus. Unless these two are brought together and studied well, we cannot come to these conclusions. So it's really important to have those data and those studies and correlate them and look at them. This is something we have to look out for because viruses are known to mutate, and it could go either way. It could get more transmissible, but less virulent, which means it causes less severe disease, which would be good. Or it could become less transmissible and, in some way it could increase the virulence as well. So we need both the lab studies, but also we need the epidemiological studies. And that's why the database that combines clinical, epidemiological, and genetic features would be extremely useful, especially in a large country like India, because they're geographically diverse. It's possible that the virus is also quite diverse. And that kind of analysis would be, I think, useful. And it needs to be kept up, ongoing kind of a surveillance.
Right, but since you've spoken about India, I would also like to know, what do you feel about the strategy of India, the way it is dealing with this pandemic? Because test, track, treat, this is the mantra that India is following. We do have very good recovery rate. We do have the death rate, the fatality rate, which is coming down. So how do you see the strategy of India?
No, and that's exactly the strategy that the WHO has been promoting from the beginning. We've been talking about the need for increasing testing capacity, the need for tracking, isolating, quarantining, and treating people, making sure that majority of people are, have mild illness and therefore only need to be observed and monitored. But a small minority do get into complications and then need, good hospital care, oxygen, etc. So the strategies are absolutely the right strategies. The challenge in India, of course, it's like many countries, right? So while in the beginning, the pandemic was concentrated in 10 cities, and then in a few states, that's where the majority of cases and deaths were happening. But as time goes on, the virus is traveling and has traveled to different corners of the country. And so the challenge is to take the learnings from the places where things have worked well, where a lot of innovation has been done, a lot of things have been tested out in Delhi, in Ahmedabad, in Chennai, in Dharavi, in Mumbai. We've learned a lot in the last few months. Now, of course, in rural areas, the strategy may be a little bit different than in urban overcrowded areas, but all of these learnings, this capacity needs to be now transferred and make sure that it exists in these slightly more remote places. We know the capacity of the health system there is limited. The health there are not many specialists, but using the existing health workforce, training them, making sure the infrastructure is there, making sure they're linked up digitally, through telemedicine, through using digital technologies,
right.
Share that information, I think will prove very useful in the days and weeks to come.
And this is exactly the way India is actually pursuing its efforts against this pandemic. Dr. Swaminathan, when we look back about 100 years ago, when Spanish flu, the world faced Spanish flu, that was a time when, it faded after 2 years. It took 2 years when many people died as well. But there was also a second wave of the Spanish flu, and that was also serious. Now, in various countries, second wave is being reported. How do you see the situation around the world where numbers are sharply rising and the second wave is actually creating a lot of fear in the minds of people?
That's a good point, and I think we need to be prepared because this virus, we know how it transmits now. We know that it transmits through droplets, that close contact, crowded settings, and closed environments where there is poor ventilation. These are the risk factors for transmission. And therefore, the moment the restrictions are lifted and people tend to get back to their normal way of living, then the transmission possibilities definitely increase. And so one has to be prepared for that. And this is what we are seeing in country after country after going into a severe lockdown. When things are opened up, and especially in places which opened up very rapidly, you can see that the cases really shot up very, very rapidly. And so this means that one has to come to a state of a balance. You cannot remain in lockdown forever. People do need to work. Education needs to happen. People need to go out and to meet their daily needs. And at the same time, you have to maintain the levels of infection at a rate at which you can actually manage it. The hospitals are not overwhelmed. We saw what happened in the beginning where hospitals and health systems were getting overwhelmed. So to find that balance, both governments and the people need to do certain things differently than what we were used to doing earlier. So one needs to prioritize, I think, in one's own life, what is important. Do we still have to go to that party, or can we avoid that party? Do we still need to have those big congregations? No, probably not. For some time to come, we have to avoid them. When I go out of the house, should I always wear a mask? Yes. Wash my hands, try to maintain a distance as much as possible from others, and try to be in places which are well ventilated. Similarly, for workplaces, for businesses, for transport sector, for the education sector, each sector needs to think about how do you make it as safe as possible and minimize the risk. The risk will not be zero, but we need to minimize it so that you can have this balance between economic activity and still keeping the infection rate low. So a lot of it is behavior change, individual behavior change, which needs to be sustained. And in fact, that's the most difficult thing to achieve. You see people become complacent in many parts of the world, especially young people felt that it was fine, that this virus was gone, or even if it's around, it's not going to affect me. And that's why the rates of infection today in the second wave are more in the young people, because the elderly are still protecting themselves and not really coming out. So young people have to have a lot of, I think, responsibility and empathy, because if they get infected, they can also infect their parents and grandparents. And then you can infect, that will be much worse for them.
Yes, so Swaminathan, do you think that in countries, for example, US and countries in Europe, as winter sets in, the cases of common flu and influenza also rise. Do you think this is going to be very challenging for them? Because it's like they'll be fighting this war at two fronts, common flu influenza on one side and COVID-19 on the other.
No, they are very worried about that. But the interesting thing is that in the southern hemisphere, when you have the flu season actually now, when it's a summer in the northern hemisphere, it was actually winter in the southern hemisphere. The observation this year is that the flu season practically disappeared. There was hardly any transmission of influenza virus. And the reason probably is that the same measures which prevent the transmission of COVID-19 virus also are effective against transmission of influenza. So the mask wearing, the hand washing, the physical distancing, and the sort of lockdowns which had happened actually prevented flu. So I think that may play a role, but also countries are encouraging their people to get vaccinated for flu, so that you can try and bring those rates down, because the last thing you want is to have two epidemics happening at the same time, which will overwhelm the hospitals. But I think these preventive measures are going to have an impact on flu as well.
All right. But regarding this coronavirus, it's like getting new information every day, or I should say conflicting information about this virus every day. The number of symptoms, the list is ever growing. Other than that, we also find that this infection, there's relapse of this infection in many patients. They are cured, but there is a relapse in these patients. Is it that we have yet to know a lot about this virus actually before we say that we know what coronavirus is?
Absolutely. I think, we've learned a lot, but we have to remember that it's only 8 months since we've discovered this new virus. And so we are learning. Last week, we've heard the first few cases of reinfection from Hong Kong, from Netherlands, and from Belgium. And in all the three cases, it was infection by a different strain of the virus. The good thing is in all the three cases, the second infections were very mild with hardly any symptoms. And so that shows that there is some amount of immunity if you get the first infection, even though you may get infected again the second time, that it's going to be much milder. Let's hope. It's only 3 cases so far. So it seems to be rare. But as I said, this is important because for vaccine development also, the understanding of immunity is going to be very important. And so over time, I think we'll be learning much more. There are many studies going on now also on the antibody levels in populations, the seroepidemiological studies. So there again, we're learning that populations have seen much more exposure to the virus than actually detected cases. So there's already some level of immunity, at least in some of the cities where there was a lot of focused infection was happening. So I think we're learning, and we have to keep on updating ourselves, and people must understand. The lay public sometimes thinks that scientists don't know what they're doing, but that's not true because science is incremental. And every day we learn something new, and we need to change our views. We have to change our ideas based on the new findings. So it's not that scientists are getting it wrong or that agencies are getting it wrong, but that information evolves, knowledge evolves, and we have to adapt our responses based on that. So it's really important globally, but also nationally and subnationally, to have good public health experts, good scientists communicating to people these changes which are happening and what does it mean for them.
Okay, Dr. Swaminathan, you were DG with ICMR. You have more than 3 decades of experience of research in tuberculosis and HIV, and you're a pediatrician also. So I would like to ask a question about children because, though this infection is impacting all the people, but children especially are more impacted because they do not have their normal childhood now. It's like wearing masks, not able to play freely and things like that. So as an expert, how do you see impact of this pandemic on children, and what do you expect from parents and the system, the society at large to do in such a case?
Yeah, I think children have been impacted in many ways. It's not just the infection with the virus, but it's had a huge impact. If you look around the world, 1.6 billion children have been out of school. Those that are lucky enough to have access to online learning, they have somehow managed, even though it's been a huge burden on the parents to teach them at home. But large numbers, do not have access to online learning, do not have access to social support, or to even the midday meals and the nutrition they used to get when they went to school. So all of those things are having an impact on the cognitive abilities, but also on the social and emotional and mental health of children around the world. They've been scared, they've been locked up at home. Many of them do not have good homes. They may be facing domestic abuse, etc. So I think we must think about impact in a broader sense rather than narrowly just what the virus is doing. But coming back to that, luckily, this virus seems to spare children in the sense children do get infected. In fact, children above the age of 10, the infection rates are as high as in adults. And children below the age of 10 seem to have slightly lower infection rates, but they do not get sick. So 99.9% of children have either asymptomatic or very mild infection, and you only find out if you do an antibody test later. A very small minority get sick and they get something called the multisystem inflammatory syndrome, which happens when the body has a too strong an immune response, too strong an inflammatory response. And that, in fact, has an effect on the heart, on the lungs, on the liver, on the other organs of the body. Most of these children also recover, but it is definitely a more serious condition. And other children who have underlying conditions, other diseases already who are not healthy, they can also have some complications from COVID. And we're learning more about the role of children in spreading the infection in the community. because it's important when we think about opening schools and so on.
Right.
But I think we have to keep in mind the broader impacts that this pandemic has had on the world's children.
Right. Also, to end this conversation, I would like to ask you an important question, because we've seen that this 21st century, the first 2 decades of this 21st century, we've seen so many pandemics and epidemics. Considering that SARS, MERS, Zika, Ebola, H1N1, and so on, and now it's COVID-19, what is the big lesson that we all need to learn from these pandemics, which are recurring so fast in this century especially, and in order to have a safe future? What is the big takeaway that countries need to learn from it?
You've touched on a very important point. We have seen over the last 20, 30 years, or even going back to HIV, that viruses which normally occur in animal populations and which don't make those animals sick, when they jump to humans, then they can sometimes cause very serious disease. And you mentioned Ebola, Zika, the Nipah virus, also, as I said, HIV, and now we have SARS-1, the SARS-CoV-2 virus. So, and then of course also H1N1, avian flu, etc. So, why does this happen? Why is it happening more now? And I think it's to do with our interaction with environment and with the with wildlife and with animals in general. So wherever there is a large destruction of the environment, people are cutting forests. Human beings are actually now spreading themselves out into areas which normally we were not in. This disrupts the local ecology. There are animals and insects and birds which are normally living deep in a forest, which then come into contact with humans, and the chances of these viruses jumping also increases. Also in places where there is farming of wild animals or illegal trade of wild animals, where wild animals are being sold along with domesticated animals for meat, etc. There again, there are many chances of these viral populations mixing with each other and resulting in some dangerous viruses which jump to humans. So that's one of the things we are trying to investigate, is actually how this virus came, from which animal species, and how did it jump, and when did it jump. So this is likely to happen in the future if we continue to do the things we are doing today. So I think a big wake-up call for us also, especially given the climate change threat, which is a bigger and a longer-term threat than this pandemic. Hopefully we'll be over the pandemic in a couple of years. Climate change is a threat to our survival, not only our species, but many species. So we need to think about how are we going to live with nature in a sustainable way, where we are not destroying the environments where other species are living, because it's for our own health and our future as well. And the second learning, I think, from this is, so the first one is the One Health approach, the animals, the humans, the wildlife, and the environment. We have to think about it sustainably. The second, I think, lesson for us is how do we prepare our health systems to prevent, to detect, and to respond to these new outbreaks and epidemics before they become pandemics. We need to stop the next outbreak from becoming a pandemic by putting in place the measures and systems which are needed to immediately detect and contain something before it goes out of hand. And that is something all countries need to invest in. I think the world has not prepared, even though there have been many warnings about pandemics. And this is the time actually to prepare and invest so that this doesn't happen again.
Right. So we do hope that though this pandemic will go away, but we must learn the lessons quickly so that in future we are able to protect our children and this world too. Thank you so much, Dr. Swaminathan, for talking to us.
Thank you very much. It was a pleasure.